Hello everyone, I'm Dr. Renzo Ginto from the Philippines, but I'm speaking right here from Harvard University, where I just started my Doctor of Public Health degree this summer. And it's really a deep pleasure for me to be addressing the members of the Medical Students Association of Kenya. I'm sad that I couldn't join you today physically as we are hundreds of miles apart. But I am very thankful that you gave me this opportunity to be able to share my thoughts, but also to engage with you in a global conversation about the theme of your conference, which is the role of medical students in universal health coverage. Again, I've said I'm a medical doctor, but I've been a member of the International Federation of Medical Students Associations, or IFMSA, which MSAKE is a part of for many years. I played several roles in the organization, including president of my NMO, which is the Asian Medical Students Association Philippines. I was also former regional coordinator for Asia and the Pacific. And the last post that I held was as liaison officer to the World Health Organization. And that is why I feel deeply passionate about global health, of which universal health coverage is an important part and subject. As I mentioned, I just started my doctoral studies, and it's very interesting and very timely that we actually just finished our discussions about health systems. What are they? What are the goals and values that health systems espouse? But also what are the functions, as well as the ways to measure their performance, the various configurations that exist globally, and as well as the forces that help shape health systems around the world. And health systems are at the heart of this discussion about universal health coverage. So before we discuss, what you medical students can do in addressing UHC, in pushing for UHC's advancement in your country, in Kenya, but also globally, I think it's important for us to define a bit some of the key terms that we're going to use in this presentation. I mentioned health systems, and a health system, as we know, as defined by the WHO, it's the collection of actors, institutions, mechanisms, activities, resources, whose primary intent is to improve health of a particular population. And in fact, in this course that I just had here in Harvard, I also got another interesting definition from Julio Frank, who was a former Minister of Health of Mexico, but also the former Dean of this school. And he said that health systems are the vehicle for the organized social response to health conditions. So it's important that health systems are functioning vigorously, because these are the channels by which we are actually able to address the health needs of society, and to ensure that people have access to essential health services, for instance, but are also protected from health risks such as infectious diseases, but also impoverishment due to health spending. So the health systems are the ones that we want to strengthen, to improve, and even transform, so that we can achieve the goal of universal health coverage. And now I want to also define what UHC is, because you'll be spending the next couple of days in your conference discussing this topic. And WHO also defined universal health coverage as having all people gaining access to essential health services. And when we say essential health services, it's a broad range of health services, from promotive services to preventative, to curative, to rehabilitative, and even palliative healthcare. And people accessing all of these services without being subjected to the risk of financial hardship or impoverishment. So we don't want people to become poor, to end up being poor, just because they needed to pay from out of their pocket in order to access these vital health services. So that is universal health coverage. And actually I remember what the Director General of the WHO, World Health Organization, Margaret Chan, once said. UHC is perhaps, the most powerful concept that public health has to offer. And she also said in her speech in one of the World Health Assemblies that UHC is the ultimate expression of fairness in society. And that is because UHC is really aiming to achieve equity in society, especially in terms of health. UHC, as we all know, has become a prominent feature in the global health agenda. It's now part of the Sustainable Development Goals. It's an important feature of the third Sustainable Development Goal, which is ensuring healthy lives. It is a big program and a priority of the World Health Organization, but also of other actors in the global health system, non-state actors such as philanthropic organizations, foundations, even universities such as Harvard, are all looking at universal health coverage. But most importantly, universal health coverage has now become a priority for the world's governments. Nearly 100 countries are actually racing now towards the finish line of UHC. And there is a huge support from civil society globally for the achievement of UHC goals at the country level and at the global level. And finally, there's a lot of research and innovation happening in this space of UHC, how we can make it work, how can we achieve them as soon as possible. So that is basically the context and a bit of the definition. And now I wish to just enumerate some of what I think are the vital or the essential principles to keep in mind when we talk about UHC. And the first one is that universal health coverage is actually, it's not just a technical fix to a technical biomedical problem, a disease, for instance, but intrinsically it is a value statement. It is a society's declaration of its values, and when I say values, these are the things that a society holds deeply. For instance, the principle or the value of equity, meaning there is fairness in society, no one is left behind, no group in society has a far greater advantage than the others, especially in terms of health. It talks about equality, and it relates to also the principle and the value of universality, which is part of that phrase, universal health coverage. We want everyone, and not just some people, to have access, ready access to health care anywhere they go, anytime they need one. It also talks about respect for dignity, and we want universal health coverage to actually be responding to people's needs and to be respecting their dignity, their personhood, and that reminds us also of the issue of quality in healthcare. We don't want healthcare to be putting a particular person at the bad situation, for instance. We want people to be satisfied with the healthcare that they receive. It talks about solidarity in society, and universal healthcare talks about unity of different actors and the population, because we are putting all our resources in a specific pool so that this pool can be shared not by just a select few but by all. And finally, another principle that is important is the principle of the right to health. And the right to health, we can say it's a legal manifestation of the rights of the values that I just mentioned a while ago. But the right to health is written in many important international agreements, the Universal Declaration on Human Rights, the WHO Constitution, many constitutions of countries across the world, and UHC has become the practical manifestation of this fundamental human right. So this is just a rundown of the different values that universal health coverage espouses, and because of that that recognition, it's important to understand also that UHC is not in itself an end goal. It is an instrumental goal. It is a means to an end. And of course, as I've mentioned, the goals are equity and equality and improved health for all. And those are the goals of the health system. But UHC is a key step towards achieving that. It is an important vehicle for equity to be realized in society. And in addition to that, when we talk about UHC, we also talk about other instrumental goals, such as I've mentioned, quality, for example. We want people to be really satisfied about the health care that they receive. And so it's another goal that we can pursue alongside other instrumental goals, such as efficiency in healthcare. When we say efficiency, to simply put it, we make the most, or we produce the best or the most health outcomes out of the smallest or the most limited resources that are available. And also we talk about productivity of the health system in terms of producing inputs such as human resources, but also medicines and all the other materials that we need to provide health care to people. So I've mentioned already about the goals, and my next point is that UHC is not just about financing, and that has been the critique of several stakeholders. Why are we just talking about money? And while we know money is so crucial in order to establish universal health coverage in health systems, we have to be very cognizant that it is just one of the many ingredients in strengthening and transforming health systems. I just want to remind you about, there are so many frameworks in health systems, but one easy framework probably that you can easily understand is the 6 building blocks framework of the health system that the World Health Organization has developed. So it's not the financing aspect, but we also need to improve, first and foremost, governance, the institutional arrangements, stewardship, and the ability of governments, for instance, and other actors to coordinate, to oversee, to plan, and to create policies that really meet the needs of the people. Human resources for health is another vital component. We need health workers to be there in the health facilities when people go to these facilities for the health care that they need. We need medicines and vaccines and other technologies, even diagnostics, to be existing in health facilities and hospitals so that people actually get treated or get diagnosed of their health conditions. We want services to be delivered in the most effective and efficient manner so that we reach the people and provide the satisfaction that they need and that they want. And health information systems are also very crucial because in this day and age of evidence-informed policy making and planning, we cannot anymore rely on gut feelings or what people just think about or some people think about healthcare, but we really need robust data to inform our actions in the health system. We need to monitor our progress, and health information systems are definitely critical. So that's my second point about UHC not just being a financing issue, but also whole systems issue. And in relation to that, my next point is that UHC is not just a technical product, or it's not just a technical issue, but it is a result of many factors in society, such as the political situation, or the economic environment, cultural practices and beliefs. People's demands are also very important in the shaping and the development and the evolution of universal health coverage. So we need all of these ingredients, all of these determinants to be in a good shape that it becomes conducive for UHC to develop and to emerge. There has to be political support from politicians, from various social movements. There has to be cultural acceptability and understanding about UHC among the general public. And we need to have a good state of financial health, and that's why economic growth is so critical also in not just establishing, but sustaining universal health coverage. It also relates to my next point, which is, and I saw the program of your conference, that you're talking about the role of stakeholders. And UHC is an enterprise of a wide range of stakeholders. It's not just the health sector. It's not just the medical community, or, for instance, your country's Ministry of Health that is deeply involved, but even the Ministry of Finance, for example, has a big role in making sure that there's money to fuel the creation and the sustaining of universal health coverage. We need an open dialogue in society where these different stakeholders get to talk and explore and examine and co-create universal health coverage in one's country. For instance, we need patients' voices to be heard, because they're the ones that will tell us what are their actual needs, are services provided in the best quality possible. The private sector has to be on board, because they're the ones providing services, for instance, or even fueling innovation, especially in terms of medicines and technologies. And also health professionals have a stake. They might be concerned about their salaries, or their positions in the health system, their employment. And so they have to be also part of the conversation. But the next point that I'm saying, amidst all these stakeholders that I mentioned, government has a key role in leading, in facilitating, in mobilizing society to form and ultimately achieve UHC. Governments have to fulfill a constitutional duty, for instance, and I believe the right to health and right to health care are embedded in the Kenyan constitution, just like in my country, the Philippines. And government is accountable to people. And so it is naturally it is the first, or it should be the first, to really initiate these discourses, these dialogues about strengthening health systems and achieving universal health coverage in a society. The next point I want to say is that some say that there are many paths to universal health coverage. It may be true, and you'll see a diversity of arrangements from National Health Service in the United Kingdom to a more a combination of tax-based and social health insurance system in Thailand. But despite the variety of arrangements and configurations, there are some common features of UHC in these countries. According to one article by Joe Kutsin, there are some basic characteristics. For instance, membership or contribution to the financing of the UHC should be made compulsory, and there are many ways to do that. We don't need to coerce people to contribute to the health financing scheme, but clearly voluntary systems do not work. The second one, and that has been shown in many studies in different countries. The second is that we need larger pools with more diverse populations rather than smaller and fragmented pools, because the more we pool the money, the bigger the money we have, and the more we can sustain the system. And the other thing is that in all these systems that exist in different countries, they are able to purchase strategically. So that's the concept of strategic purchasing in order to sustain progress. So, we cannot just, for instance, purchase services individually, but we can use the single payer power of the health system to be able to purchase the greatest amount of services for the greatest number of people for the least cost possible. And so these are some of the important principles in the evolution, in the development of UHC, which I'm pretty sure that you're seeing firsthand in your country's own journey to universal health coverage. But it is important to be reminded that to improve health and equity overall, UHC is important, but certainly not enough. And what I want to inject here is that we still need to address the broader social, environmental, economic, and political determinants of health. These are the determinants that ultimately lead to health or disease, or health equity or health inequalities. And so it is important that we don't lose sight of these broader determinants that dictate the distribution and the level of health in a population. And these determinants can also impede or slow the progress of UHC achievement if we fail to address them. So I want to proceed to my concluding remarks. And we've talked about UHC, we've talked about health systems, we've talked about the values and the features and some key principles and the importance of stakeholder engagement. And we medical students are one of the important stakeholders in this important business. And while you may be medical students for now, I encourage that you don't underestimate your position as young people, because as young people you can actually make a lot of great things with your energy and enthusiasm, with technology within your reach, with your convening ability, and your organization, MSAKE, can definitely be the platform for action to happen. And so I just want to give some tips on how you can engage in the development of UHC as early as now, while you're still medical students, as I have been involved in my country when I was still a medical student. One is that it's important that we, as early as now, learn and understand what universal health coverage is, what health systems are, what they do for our society, how can we better improve them, even in the most elementary of ways or levels. And there's no need to become a health economist for now or to act like a sociologist. It's just important to be interested, to embrace it, and to just be curious about the health system and universal health coverage. Because we are the future users, implementers, and leaders of these systems in the years to come. And it's important that as early as now, we develop the capacity for understanding, but also to be able to intervene in addressing the many challenges that our health systems face. We should understand the complexity of these systems, and also try to look at these health issues from different lenses, because only then we can find more effective and more cross-sectoral solutions to the many challenges that we will be confronting in the future. And it relates to the importance of incorporating health systems education, UHC education, and the broader medical and health professions education. And I'm pretty sure that MSAKE and IFMSA can play a critical role in making sure that these are integrated in the curriculum. You can also play vital roles in, for instance, working with communities in better understanding UHC, in educating them about their basic entitlements, and also helping them gain real access to the services that your health system provides. Because oftentimes, people on the ground have limited understanding and they are not able to utilize the benefits that are being promised to them by universal health coverage. You can also do research, and probably some of you are about to, fulfill some research requirements in medical school, and maybe your faculties will be open to proposals for, conducting health systems research. In addition, or instead of doing biomedical research, and there's so many questions about health systems and universal health coverage that still needs to be answered that you might be interested to deep dive into. And then finally, we can be powerful advocates for universal health coverage. We have to push for better health policies, and we can be powerful voices for fellow young people, but also for future generations. And so I will encourage you as individuals, but also your organization, to be deeply involved in in the national conversation. You can attend government meetings or hearings in your Congress or Parliament, or just start a national campaign spreading awareness about UHC and making government, holding governments to account so that they are able to fulfill their responsibilities and obligations. So that's it. I mean, UHC is a very important concern for global society today, and I myself am very excited to be involved in the formulation, in the further improvement, in the advancement of UHC in my home country in the Philippines, but also globally. Shortly before I came to Harvard, I got involved in some health systems research projects where we actually tried to study primary healthcare systems and how we can strengthen them so that we can ultimately achieve universal health coverage. And so I invite you, this is an invitation to you medical students, fellow medical students, to be involved, to participate, because UHC is ours, and UHC is something that we will be inheriting as future doctors and health professionals. And so there is no better time to study it, to be curious about it, and to embrace it than now. So thank you very much, and I wish you a great conference, and I look forward to not just meeting you, but working with you in the near future. Bye.